We started out with people ages 45 to 60. Now we're expanding down to age 30, or maybe we're going after pediatric indications for this product. In spine, maybe we're going after more levels, and we start out in lumbar, now we're in thoracic, and there's just all these other things that companies will do to try to expand their market.
Yep.
That's where you see those kind of studies. And then return to work and those type of things. And then finally you get your code and you get your coverage, and you get financially feasible. Okay, so if that's the case, you're ahead of the game again.
Yep.
You know the 5 questions, and you know that every company in med tech does studies in that sequence. Let me unlock the last piece of it for you. Physicians receive training through journal clubs and other things, and research that they have to do as part of their residency and their training. They're taught how to present clinical studies. When they go up on the podium at meetings, they present clinical data a certain way. Well, wouldn't you like to know how to do that? Because when you do it that way, they perk up and they go, Jacob, how do you know how to do that? Because you're doing it the way we do it, right?
I was going to say, now you're talking their language.
Correct. That's exactly right. So I want to give our audience that opportunity today. Okay.
Yep.
The second thing is this: physicians, when you leave them papers, or you present them papers, and they do ask, hey, can I get a copy of that? They really do read them. Now, these are people who do not have time. So you say, well, how do they have time to read that? Well, they break the study down very quickly because of what I'm about to show your audience. Okay. So let's go there. Let me share my screen real quick.
All right. And you guys, why Jason's doing that, I just hope, like, in this first 5-10 minutes, that you guys are seeing the value. When I tell you that Jason's a true expert, what he just told you, what goes on and how they do their studies, I can sit here and tell you most reps never know that. I can say that because I didn't know 100% that was how they do every single part of the study. So again, you guys, this is a learning opportunity for myself as well, just being with an expert like Jason. So I really hope you guys are taking these notes, and you guys go back and listen to this, because you want to be a true expert. This is literally what Jason does for his life. He teaches people how to be really good at sales. And we just were talking about a lot of the successes he's been having with a lot of current customers. And so I just hope you guys know the gem you're getting right now. So make sure that you continue to take notes and listen.
Speaking of which, if your audience reaches out, I will gladly give them this thing that we've put together here. This is free, and they're welcome to it. But this is called Effective Communication with Clinical Literature. Okay, this is something I've developed and that I teach in my classes. And what we're gonna do is we're gonna go through these 9 questions, explain them, and then we're gonna go look at a specific example. I'm gonna bring up the Tomei paper from one of my clients that looks at spine. So everybody knows that there's body language. We're not going to talk about that, but 7% of your message is attitude. It's not so much what you say, but how you say it. Set that aside. When we're looking at clinical studies in particular, you need to know that you're going to break down a clinical paper looking for these things. That's how you can go fast and skim it, because you know what you're looking for and you know where to find it. And you know that you're going to present this to your physician. So then we'll take a look at Tomei and break it down, but we'll keep this very simple. Here are the questions you want to ask. First of all, every study ever done was done to answer a question. So state the question. What question was this paper trying to answer? So Dr. Tomei is trying to answer the question, is Barricade effective? Dr. Jones was trying to establish, is this safe? Dr. Alec was, trying to demonstrate that this was actually effective in these patients, and that we could do it in this amount of time. Whatever the question is, always state the question. Every clinical study ever was done to answer a question. So state the question. State the author. So in this case, Dr. Tomei is getting first billing. But make a note, sometimes at teaching institutions, the very influential, world-renowned person isn't first. They're dealing with residents, and the residents are doing the grunt work for this particular trial or the study. And so the world-renowned person will put their name last. So it's important that you work with your company, and important you work with your research team and figure out who's who in these papers. Who's the big name, who's the world-renowned person? And maybe there's 4 or 5 of them that are worth noting, because sometimes the power of the paper is in the name. Who was associated with that paper? Who are the investigators? All right. State the purpose. So the question is one thing, but the purpose is another thing. The purpose is usually in the title. So here we have annular closures and lumbar discectomies for prevention of reherniation. Okay. So the purpose is a little bit different than the question. The question is it safe? Is it effective?
Yep.
Is it easy to use? But a purpose is a little more formal, and it's usually in the title. All right. Sometimes it'll be comparative. Sometimes it'll be the landmark. Sometimes it'll be investigational. State the methods. Now, number 4 is probably the one I want to draw the most attention to. You're always having to answer the question, why should I believe you? Jacob, every time you come in with a clinical study, I'm going to assume that it's making your product look good.
Yep.
So
100%.
I'm already cynical. I'm already skeptical. Right. Of course you're showing me a paper because it's making your device look good. Of course you are.
Yep.
Okay. So you have to acknowledge that right up front.
Yep.
Why should I believe you? Well, the answer is because of the methods. Look at how we did the study.
Yep.
Prospective versus retrospective, randomized, controlled, double-blinded. So many times people mispresent what it means to be double-blinded. And so you have to dig into your study and look how it was built. And what I want to say is the easiest way to present the concept of double-blinded is that the investigator and the operator, or it could be the evaluator and the operator, were two different people. So Jason does the initial assessment, Jacob does the surgery, and Jason does the follow-up. The person who did the operating doesn't do the assessing or the evaluating. Those are separate people, and they're both blinded to who the patient was and what surgery did they get. You know, maybe there was a control group where one person got the procedure and the other person got a placebo or didn't get surgery, right? And then the comparator and the evaluator doesn't know which group got the operation. It's that kind of a situation. So if the operator and the evaluator are separate, that's double-blinded. So dig in hard to the methods. The reason you should believe me is because of how we did the study. We did it to this level. We went for superiority, not equality. There's all these markers and ways of doing it. And you want to be able to say, we're bringing this technology to market responsibly. We designed the study the way you would want us to do it. That's a really important statement. These physicians are anxious to see that you're doing it the right way, to the highest standards.
Success requires insights. Elite execution requires training. Go to www.exsalesconsulting.com/special offers.